Welcome to the Deep Dive. We uncover these really cool insights, straight from the research world.
Oh, for sure.
And today we're going to be exploring something pretty amazing, I think.
Yeah.
AI that can generate radiology reports
Oh, wow.
from chest x-rays.
That's right. It's not just about AI identifying things in the images anymore, no.
Right.
We're talking about AI that can actually write up the report like a human radiologist.
Yeah, it's mind-blowing, honestly, to think we might be able to get, preliminary readings on these x-rays almost instantly.
Yeah.
Imagine, how much faster diagnoses and treatments could be.
Yeah, absolutely.
So our guide for this deep dive is a research paper about something called ReXrank.
ReXrank is essentially a public leaderboard that ranks different AI models. Based on how well they can generate these radiology reports. Think of it like a competition for AI doctors.
Okay, I love
all vying for the top spot.
But before we get into who wins this competition,
right,
let's talk about why this whole area of research is such a big deal.
Okay, so one of the biggest challenges in radiology is the sheer volume of x-rays that need to be read.
Yeah.
Radiologists, they're incredibly skilled and dedicated, but they're only human.
Of course.
There's a limit to how many x-rays they can analyze in a day.
I imagine it's not just about the number of x-rays, it's also about the complexity of the analysis, right?
Absolutely. Writing a radiology report, it isn't just about describing what you see in the image.
Right.
It requires a deep understanding of anatomy, pathology, and clinical context.
Yeah.
It's a very specialized skill.
So if AI can help streamline this process, even a little bit, it could potentially, free up radiologists to focus on the most complex cases.
Exactly, yeah.
Ultimately improve patient care.
Yeah.
So that's where ReXrank comes in.
Right.
Can you tell us more about how it works?
So before ReXrank, it was really difficult to compare different AI models for this task. Everyone was using different data sets and different ways of measuring performance.
So it was like comparing apples and oranges.
Exactly. ReXrank solves that problem by creating a standardized testing ground.
So it's like the SATs for AI doctors.
Exactly.
Everybody takes the same test. We can see who really excels.
And one of the key things that makes ReXrank so robust is that it uses a variety of data sets to evaluate the models.
Okay.
They're using both public and private data sets, including one called ReXGradient, which is massive. It contains over 10,000 studies from 67 different medical sites across the U.S.
Wow, that's impressive. Why is it so important to use such a diverse data set?
Well, imagine an AI that was only ever trained on x-rays from one hospital.
Okay.
It might do great on those x-rays, but what happens when it encounters an x-ray from a different hospital with different equipment or different patient demographics? By using a variety of data sets, ReXrank ensures that the AI models are tested on a wide range of cases, which makes the results more reliable.
Yeah.
And applicable to real-world clinical settings.
So it's like making sure that your AI doctor has a well-rounded education.
Exactly.
They haven't just been cramming for one specific exam.
Yeah, and it's not just about the data sets themselves, it's also about how they're used to measure performance.
Okay.
ReXrank uses a variety of metrics that go beyond just comparing the words in the AI-generated report to the words in a human-written report.
You mean it's not just about whether the AI can write grammatically correct sentences. It's about whether, the content of the report is clinically accurate and useful?
Exactly. One of the key metrics they use is something called RED-CLICU.
Okay.
It's a composite score that takes into account both textual similarity and clinical accuracy. So it's looking at both how closely the AI's report matches a human doctor's report, A&D, how accurate the information is from a clinical standpoint.
So it's not just about sounding right, it's about being right.
Exactly.
It makes a lot of sense, especially when we're talking about something as important as medical diagnosis.
Absolutely. And they use a whole bunch of other metrics, too, each one designed to capture a different aspect of report quality.
It sounds like they're really putting these AI models through the ringer. Now, I'm dying to know who comes out on top in this competition.
Well, the top performer is a model called MedVersa.
Okay.
And get this, it even outperformed GPT-4V on some of the tests.
GPT-4V.
Yeah.
Now, that's a name I recognize.
Right.
It's that super advanced AI that's been making headlines.
Yeah.
The one that can understand both images and text.
That's the one.
Yeah.
It's considered to be one of the most advanced AI models out there, so for MedVersa to be outperforming it on some tasks is truly remarkable.
Okay, color me impressed. But you said it outperformed GPT-4V on some of the tests. Does that mean MedVersa isn't perfect?
Even the best AI has room for improvement, and it seems that MedVersa had a bit of a snag with a dataset called CheckSpert Plus. It had a slightly lower performance on this particular dataset.
That's interesting. What do you think is causing this, dip in performance?
The researchers believe it might be due to CheckSpert Plus having a slightly different data distribution compared to the other datasets. It seems that the X-rays in CheckSpert Plus might have some unique characteristics that MedVersa wasn't quite prepared for.
So it's like MedVersa encountered a patient with a rare condition that it had never seen before and wasn't quite sure how to interpret the X-ray.
That's a great analogy. It just goes to show that even with all the advancements in AI, there's still a lot we need to learn and understand. And that brings us to one of the key takeaways from this research.
And what's that?
The importance of diversity in training data. If we want AI models that can perform well in the real world, we need to train them on a wide variety of data that reflects the diversity of patients and clinical settings they'll encounter.
So it's not enough to just feed an AI a massive amount of data. We need to make sure the data is diverse and representative of the real world.
Exactly.
That makes a lot of sense.
And another key takeaway is that models trained on multiple datasets tend to perform better overall. They're exposed to a wider range of cases and learn to generalize better, which makes them more adaptable to new situations.
So it's like sending your AI doctor to multiple medical schools instead of just one. They get a more well-rounded education or better prepared for whatever they might encounter in their practice.
Exactly. And there's one more interesting finding I want to highlight before we move on.
Okay, I'm all ears.
It seems that the impression section of a radiology report poses a particular challenge for these AI models. They tend to struggle more with this section compared to the findings section.
That is interesting. Why do you think that is? Is it just because the impression section is usually shorter and more concise?
It's not just about the length. The impression section is where the radiologist summarizes their findings and provides their overall interpretation of the X-ray. It requires a higher level of reasoning and clinical judgment, which, even for human radiologists, can be the most challenging part.
So it's like the AI is great at spotting the individual pieces of the puzzle, but hasn't quite mastered the art of putting them all together to form a complete picture.
That's a great way to put it. It suggests that there's still a lot of work to be done in teaching AI how to not just see, but to truly understand and reason like a human clinician.
Well, this has been a fascinating deep dive so far. I'm already amazed by the progress that's being made in this field, but I'm also really intrigued by the challenges that lie ahead.
Welcome back to our deep dive into the world of AI-powered radiology.
Yeah?
We've been talking about ReXrank, which is like a giant competition for AI models that generate reports from chest x-rays.
Right.
And we've learned that one of the keys to success in this competition is being trained on a diverse range of data.
Oh, for sure.
So let's dig a little deeper into those data sets and see what makes them so special.
We've already touched on ReXGradient, which is this massive data set with over 10,000 studies from all across the US. It's like the ultimate test to see if these AI models can handle the variety of x-rays they might encounter in real-world clinical settings.
Right, because you don't want an AI that's only ever seen x-rays from one specific type of hospital or one specific population.
Right.
It needs to be able to generalize and adapt to different scenarios.
Exactly. And that's why it was so interesting to see that even MedVersa, the top performer, struggled a bit on the CheckSpert Plus dataset.
Right.
Remember how we talked about how MedVersa's performance dipped a bit on that one?
Yeah, it seemed like it threw MedVersa for a loop.
Well, that's because CheckSpert Plus has a slightly different data distribution than the other datasets. It's like it came from a different world of x-rays, and MedVersa had to adjust its thinking a bit.
So it reinforces the idea that you need to expose these AI models to as much variety as possible during training.
Yeah.
Otherwise, they might be amazing at interpreting one type of x-ray, but completely miss the mark on another.
Absolutely. Now let's talk about another dataset that plays a big role in ReXrank, MIMIC-CXR.
MIMIC-CXR, that rings a bell.
Yeah.
Isn't that one of the most widely used public data sets in this field?
It is. It's huge. Containing over 377,000 chest x-rays from a hospital in Boston. Researchers all over the world use it to train and test their AI models.
But the paper mentioned that MIMIC-CXR has some limitations when it comes to evaluating how well AI models can generalize.
Yeah.
What do they mean by that?
Well, the thing about MIMIC-CXR is that all the data comes from a single institution. So while it's a great resource for training, it might not fully represent the diversity of x-rays that an AI model would see in practice.
It's like if you trained a doctor in a very specialized clinic. They might be amazing at diagnosing certain conditions, but struggle with others they've never encountered before.
That's a perfect analogy.
Yeah.
And that's why it's so important to have data sets like ReXGradient that include data from multiple institutions. It ensures a more comprehensive and diverse representation of, real-world scenarios.
Okay, that makes sense. Now, what about the IU X-ray data set? We briefly touched on this earlier.
Ah, yes, the IU X-ray dataset.
Yeah.
This one is interesting because it's a public dataset.
Okay.
But the researchers found that it might actually be too easy for these AI models.
It's too easy.
Yeah.
Like giving them a pop quiz instead of the final exam.
Exactly. The AI models consistently perform well on the IU X-ray dataset, which suggests that it may not be challenging enough to really distinguish the top performers.
So we need data sets that are kind of like Goldilocks, not too easy, not too hard.
Right.
But just right to really push these AI models to their limits.
Precisely. And that brings us back to why ReXrank is so valuable. By using a combination of datasets, including both public and private ones, with varying levels of difficulty, it provides a much more robust and comprehensive way to evaluate these AI models.
It's like having a panel of judges instead of just one, each with their own expertise and perspective,
Right.
Giving a more well-rounded assessment of each AI's capabilities.
Now, there's one more dataset I want to mention, CheckSpert Plus. This one is relatively new. It was actually introduced in a paper published earlier this year.
And if I remember correctly, this is the dataset that seemed to trip up MedVersa, despite its stellar performance on other datasets.
That's right. What's intriguing about CheckSpert Plus is that it really highlights the challenge of real-world variability. You see, the researchers think that MedVersa's dip in performance might be because the CheckSpert Plus data has a different distribution than what the model was trained on.
So even though MedVersa had seen thousands upon thousands of x-rays, it still encountered something new and unexpected in CheckSpert Plus.
Exactly. It's a good reminder that the real world is messy and unpredictable, and that AI models need to be able to handle that variability.
So it's not just about the size of the data set. It's also about the quality and diversity of the data, making sure it captures the nuances and complexities of real-world clinical settings.
Absolutely. That's a crucial takeaway for anyone developing AI models in healthcare. It's not enough to train on a massive data set. You need to ensure that the data is representative of the real world.
Because in the real world, you never quite know what kind of X-ray you're going to get.
And speaking of those X-rays, let's shift gears a bit and talk about some of the different approaches that developers are taking to build these AI radiology report generators.
Sounds good to me. We already talked about ReXGradient, which was specifically trained for chest X-ray interpretation, and RGRG, which uses object detection to focus on specific anatomical regions.
Those were definitely some standout models, each with its own unique approach to tackling the challenge.
Were there any other, creative approaches that caught your eye?
Yes, there was one model I found particularly interesting called RADFM. It was designed to be a real workhorse, capable of handling both 2D and 3D scans, even when there are multiple images involved.
Wow, that's impressive. So it's not limited to just chest X-rays.
Exactly. RADFM's flexibility makes it a promising candidate for a wide range of applications in radiology. From analyzing CT scans to MRIs, it's designed to handle it all.
It seems like the possibilities are endless. But for now, let's bring it back to our main focus,
Right.
chest X-rays and AI-generated reports.
Yeah.
I'm curious, were there any other, surprising findings from the ReXrank research?
One observation that stood out was that the AI models seem to have a harder time with the impression section of the report compared to the findings section.
Now that you mention it, we've talked about that a few times.
Right.
Why do you think that is? Is it just that the impression section is shorter and, therefore harder for the AI to grasp?
It's not just about the length. Remember, the impression section is where the radiologist summarizes their findings and offers their overall interpretation and diagnosis. It requires a higher level of reasoning and clinical judgment.
So it's not just about recognizing patterns in the images, it's about understanding the clinical significance of those patterns and making informed decisions based on that understanding.
Precisely. And that's where AI still has some room for improvement. While these models are getting very good at identifying findings and generating descriptive text, they haven't quite mastered the art of clinical reasoning and judgment.
Which makes sense because that's something that human doctors spend years honing, through education, training, and experience.
And it raises an interesting question for developers of AI models in healthcare. How do we teach AI not just to see, but to truly understand and reason like a clinician?
That's a great question to ponder as we wrap up part 2 of our deep dive. Join us for part 3, where we'll explore the future of AI in radiology and what it all means for you, the patient. Welcome back to the deep dive. We spent the last 2 parts, diving deep into this world of AI-powered radiology.
Right.
We've learned about ReXrank, this incredible platform for evaluating AI models that can, generate those radiology reports from chest X-rays.
Yeah.
And we've explored, the importance of those diverse and challenging data sets for training these AI models.
Absolutely.
So it's been quite a journey,
Yes.
uncovering all these insights. And now I'm, really excited to shift our focus to the future.
Me too, me too.
Yeah.
What does the future hold for AI in radiology?
Well, the potential is truly immense. As these AI models continue to evolve, they could revolutionize the way radiologists work, leading to faster diagnoses, more accurate results, and ultimately better patient care.
Yeah.
I can definitely see how that would benefit both patients and radiologists. But what would that look like in practice?
Imagine a world where AI handles the initial screening of all chest X-rays.
Okay, yeah.
It could quickly analyze the images, identify any potential abnormalities, and flag them for the radiologist's review.
That would free up a lot of time for radiologists, wouldn't it?
Exactly. It would allow them to dedicate their expertise where it's most needed, and potentially even reduce wait times for patients, leading to faster diagnoses and treatment.
And if AI is able to, pick up on those subtle details that a human eye might miss, it could even lead to improved accuracy, right?
That's right. AI could act as a second reader, providing an extra layer of scrutiny, helping to reduce the risk of errors.
It's like having a tireless, ever-vigilant partner in the reading room, always, double-checking, ensuring nothing gets missed.
But of course, with any powerful technology, we need to consider the potential implications.
And in this case, those implications extend far beyond the radiology department, right?
Oh, yeah.
We're talking about the future of healthcare.
Absolutely. And that's why it's so important to have these conversations now as the technology is still developing.
Speaking of those conversations, I'm curious to hear your thoughts on the role of human radiologists in this future world, where AI plays, a larger role in image analysis.
I believe human radiologists will always be essential. Their expertise, clinical judgment, and ability to connect with patients on a human level are irreplaceable.
So it's not about AI replacing radiologists, but rather augmenting their capabilities, empowering them to provide even better care.
Exactly. AI can handle the routine tasks, freeing up radiologists to focus on the more complex and challenging cases, the ones that require their unique skills and insights.
That makes a lot of sense. It's a partnership, a collaboration between human and artificial intelligence working together to improve patient outcomes.
And as we move forward, it's important to ensure that this partnership is guided by ethical principles and a focus on patient well-being.
Well, we've covered a lot of ground in this deep dive, from like the technical details of AI models and data sets to the broader implications of AI in healthcare and the future of radiology.
It's been an incredible journey, and I hope our listeners have gained a better understanding of this rapidly evolving field.
Yeah, me too. And to all our listeners out there, we encourage you to stay curious, stay informed, and be a part of the conversation about how AI is shaping our world. Because the future of healthcare is a story we're all writing together.
That's a beautiful sentiment. And with that, I think we've reached the end of our deep dive.
Thanks for joining us. Until next time, keep exploring.